Hey there, health warriors, feeling tired all the time, struggling with dizziness, pale skin, or shortness of breath? These could be signs of anemia, a condition where your blood doesn't carry enough oxygen. But did you know there are different types of anemia, each with its own cause and treatment? Today we're breaking down iron deficiency, B12 deficiency, and sickle cell anemia, what they are, how they're diagnosed, and the best ways to treat them. Let's get started. Anemia happens when you don't have enough healthy red blood cells or hemoglobin to carry oxygen throughout the body. This leads to fatigue, weakness, and shortness of breath. How do we diagnose anemia? Doctors check 3 key lab values. Hemoglobin. Low levels mean less oxygen carrying capacity. Hematocrit measures the percentage of red blood cells in the blood. Mean corpuscular volume determines whether red blood cells are small, normal, or large. Now let's break down the 3 most common types of anemia. For iron deficiency anemia, causes include poor dietary intake or not enough iron-rich foods like red meat, spinach, or beans, blood loss such as having heavy periods, gastrointestinal bleeding, ulcers, pregnancy and increased iron demand. Symptoms include extreme fatigue and weakness, pale skin and brittle nails, cold hands and feet, craving ice or non-food items known as pica. Treatment includes iron supplements like ferrous sulfate, best absorbed on an empty stomach with vitamin C. An iron-rich diet including leafy greens, red meat, lentils, and fortified cereals. Treat the underlying cause. If due to bleeding, identify and stop blood loss. Iron deficiency anemia is the most common type, but also the easiest to correct with proper nutrition and supplements. For vitamin B12, deficiency and pernicious anemia. Causes include low dietary intake, common in vegans and vegetarians. Pernicious anemia, an autoimmune condition where the body can't absorb B12. Gastric surgery or chronic gastrointestinal conditions like Crohn's disease or celiac disease. Symptoms include fatigue and weakness, tingling or numbness in hands and feet, memory problems or brain fog, glossitis, which is a swollen, inflamed tongue. Treatment includes B12 injections or high-dose oral supplements. A diet rich in B12 including eggs, dairy, fish, and fortified cereals. Monitor neurological symptoms. If untreated, nerve damage can become permanent. If a patient has neurological symptoms along with anemia, always check B12 levels. Sickle cell anemia is caused by an inherited genetic mutation that affects the shape of hemoglobin. This condition is most common in African, Mediterranean, Middle Eastern, and Indian populations. Symptoms include severe pain crises, also known as vaso-occlusive crises, shortness of breath, fatigue, jaundice, which is the yellowing of the skin and eyes, and swelling in the hands and feet. Treatment and nursing care involve hydration and oxygen therapy to prevent the sickling of cells, pain management with NSAIDs and opioids for severe pain crises, blood transfusions in severe cases, and medications like hydroxyurea, which reduce sickling and pain crises. Sickle cell anemia is a lifelong condition, but proper management improves the quality of life. Interventions are crucial in managing anemia. First, assess and monitor symptoms by checking hemoglobin, hematocrit, and mean corpuscular volume levels, and monitor for fatigue, dizziness, and pallor. Second, provide oxygen therapy if needed, as oxygen helps compensate for low oxygen carrying capacity. Third, educate patients on diet and supplements, encouraging iron-rich and B12-rich foods, and teach proper medication use, including iron supplements and B12 injections. Finally, manage pain and complications, especially in sickle cell anemia, by providing hydration, heat therapy, and pain relief, and prevent infections by encouraging vaccination and hand hygiene. Tailoring treatment to the type of anemia ensures better patient outcomes. Anemia affects millions of people, but with the right diagnosis, treatment, and nursing care, patients can manage their symptoms and improve their energy levels. Have you or a loved one experienced anemia? Share your experience in the comments below. If you like this video, give it a thumbs up, and don't forget to subscribe for more healthcare education and nursing insights. And remember, understand anemia, treat it right, stay healthy.